Are my slides coming up? Do you want me to use this? So, welcome to Alameda County. I work for the county health jurisdiction. We're the 6th largest county in California and one of the most diverse, both culturally and economically. As illustrated by this slide here, an African-American child that's living in the Oakland Flatlands or West Oakland will die on average 15 years before a Caucasian child living in the city's most affluent areas or the Oakland Hills. So as Dr. Wolf and Dr. Bosch talked about, the conditions that create this gap are very complex. And if we were to map out, chronic absenteeism or asthma, whatever it is, a similar gap is always going to exist. So what this tells us here in Alameda County, is that there's never going to be one intervention, one organization that can fix these complex issues. It takes actually a common agenda with shared results across health and education sectors to achieve measurable and lasting change. So here in Alameda County, we envision a county where all youth graduate from high school healthy and ready for college and career. And the way we approach this is that we actually do school health initiatives, which are driven by these results here, that children are physically, socially, emotionally healthy, succeed academically, that their environments are safe, that families are supported, and that the systems are integrated and care is coordinated and equitable. And so we have to do this, and obviously as a county, we don't do these by ourselves. We do this with our education partners, we do it with our health partners, we do it with actually businesses sometimes, we do it with philanthropy. It takes hundreds and hundreds of organizations for us to come together and develop these school health initiatives. But one of the things that we like to say at the center, or our director actually says, really what we're really trying to do is not actually fix kids, we're actually trying to change the adults. That's really our role. So in these school health initiatives in Alameda County, we focus on systems integration and partnerships around these results. And one of our, though we do services and we have key actions that we take, and one of them, I'm gonna get this, is our school health centers. And as you can see, we have 29 school health centers. We provide a little over $100,000 a year in a base allocation to each school health center so that they are required to do medical, some dental, health education, mental health, and actually youth leadership activities or youth development, things like even health career pathways. And we have an evaluation model that we use called results-based accountability, and it's by Mark Friedman. And the three questions that we ask are: how much did we do? How well did we do it? And is anyone better off? And the way we collect data for our school health center initiative is we collect client level data, so individual visits. We do client surveys of the school health center users. We have, in California, we use California Healthy Kids Survey. We don't use the YRBS. But we have a module in our California Healthy Kids Survey just for school health centers. So we know and we ask who's used a school health center. So like when you looked at, I think it was Dr. Bosch's slide about feeling sad and depressed over the last 2 weeks. We know, did they go to a health center or not? Did they report doing it? So we can do some comparison there. So some of the related responses that we get from the students, that they have goals and plans for the future, they want to stay in school, they do better, that the school health center helped them with their academics in some ways. The other thing that we can look at through the California Healthy Kids Survey is, and then we can compare high-frequency users to low-frequency users and to students who haven't used a school health center of like, did they know where to go for help if they're feeling stressed, nervous, sad, depressed, or they talk to a doctor or a nurse about how school's going, when needed, I always receive counseling to help me deal with issues like stress, feeling sad, family problems, or alcohol and drug use. And so the high frequency users reported at a higher rate that they were able to get this. Another project that we did through a grant in 15 of our Oakland school-based health centers is to look at trauma-informed care. And so all the different school health centers actually implemented their own trauma screening, and you can see some of the examples of what they use to screen for trauma. Now, obviously, not everyone that screens positive for trauma is going to have a need. So of the 35% of those that were screened positive and actually needed follow-up care, 86% of those were connected to actual services. In addition, a follow-up focus group of those in this study, 83% of the trauma support participants felt that the group helped them stay in school. So I think a little bit of what I'm trying to highlight here is the conversation that we have around our health results have to be in the language that is important to educators, because really how we sustain and keep moving this work forward is having those partnerships and those relationships and having trust that what we're doing is in service to the same results. So in end, you know, each and every child needs to get what they need to thrive. And sometimes it comes across as like we're only serving a certain subpopulation of high need. But if we can create systems and a model that serves those most at need, everybody, all students and all families who even need a little bit less will benefit from the improved coordination in services. Thank you.
Hey, great. Now we have Jill joining from video conference.